Generally, the number one sign for gum disease is bleeding. So if you're brushing your teeth and there's blood, that's a sign there's an infection there. If you floss your teeth and there's blood, there's infection there. Now, some people don't floss because they say, well, when I brush, there's no bleeding, but when I floss, there is. So I'm thinking I'm causing a problem. No. Any kind of bleeding around your teeth is infection. And everybody from time to time will have some infection in their mouth, either gingivitis, like the tooth commercials on TV, where they talk about this kind of Aquafresh as opposed to this type of Crest. But really, it's bacteria that's causing the problem. One of the things that's interesting is a lot of patients will say sometimes that, well, you know, my parents had gum disease. You know, is it hereditary? Is it something that, you know, am I just going to be more prone to it? There are tests we can run nowadays, and this also goes along with the diagnosis. If we suspect somebody or an individual might be at more risk to gum disease, we can run tests to see what is a good way of treating it. And what I mean by that is bacteria attacks your body. I have a lot of patients, for instance, that will come in, husband and wife, an example. Husband never brushes his teeth. Maybe he does once in a blue moon when his wife tells him to. Wife brushes her teeth, flosses them all the time. They come in every 6 months, or he does maybe once a year. She comes in every 3 months, has her teeth cleaned, and her periodontal condition, her gum condition is getting worse and worse and worse, even though she's the one that does everything by the textbook. She brushes and flosses. She rinses. She comes to see us all the time. Whereas the other individual, he never brushes, never seems to have as big a problem. What's going on there? Well, twofold. It's not the bacteria necessarily by itself that's causing the problem with gum disease. It's the person's genetic makeup and how they respond to that. It's a fight, it's a war, it's a battle. If you think of two lines drawing up, it's the bacteria and it's you fighting each other. And the fallout of that war, the collateral damage, is what is causing the problem. You know, when they talk about dropping a bomb in Iraq, what's the collateral damage to the surrounding area? So it's really the host or the human, the body itself, and its reaction to the bacteria that's causing the damage. So when we see something like this, husband and wife, a lot of times what we'll do is we'll do genetic testing, and we'll find that the husband has a different genetic makeup that makes him more resistant to the bacteria, while the wife is less resistant. So treatment really involves treating them both so that they can get healthy, because we can treat her, but if they're still kissing and things, if it is infectious, he's infecting his wife. So we want to make sure that they stay healthy, and so we have to tailor the treatment that way. If you suspect you have gum disease, or you suspect, oh, I think I have a problem with it, first thing that you need is you need a diagnosis. And you need to see a dentist and have a diagnosis of what's going on, because you want to know what stage the disease is in. Okay? Because there are different kinds of treatments that you can do. Some of it's surgery, and that's scary. Some of it's non-surgical, not as scary. But it really depends on the diagnosis for the patient.